Welcome back at 6:42 this morning. The Zika virus remains a concern for the state of Texas. Just last month, the Texas Department of State Health Services and Hidalgo County Health and Human Services determined an Hidalgo County resident who previously had a Zika infection was most likely infected in Texas.
State of Health Services Department Commissioner Dr. John Hellerstedt joins us now with more on what the state is doing to combat locally transmitted Zika. Doctor, exactly what is the state monitoring in terms of Zika right now?
Well, we have really an array of activities that we're engaged in. Among other things, we have the ability to go and trap mosquitoes and count the populations. So where we see populations increase, we can sometimes take countermeasures to decrease those populations. The mainstay, though, really of our efforts against Zika is to make sure that we detect the presence of local disease spread in human beings as quickly as possible. So a big piece of that for the lower Rio Grande Valley is that we want every pregnant woman in those counties to be tested twice routinely, whether they show symptoms or not. And we think that's a really good way to actively be looking for evidence of the infection.
Now, under what conditions will the health alert for the valley be lifted?
Really, it's a matter of time. The health alert, I think, helps remind people that there has been Zika transmission in the area. Right now, we're getting back into that portion of the summer where the risk is rising again. So we're having conversations with folks about whether or not to recommend to the CDC, it's really their designation, whether or not to recommend to the CDC that they lift it. In a big way, it doesn't really affect the way in which we do our surveillance, in other words, look for the presence of the disease, and it doesn't really affect the countermeasures that we're taking right now.
And Doctor, let's talk a little bit about how the state is working to educate Texans, specifically people here in the Valley. I know you were down here recently.
Yes, absolutely. Again, there we have a spectrum of activities that we're engaged in. So one thing I'd like to point out to folks is our website, www.texaszika.org. That's one word, Texas Zika. And people can go on there and get really a wealth of information, whether they're the general public, a pregnant woman, or even a healthcare professional. So that's a great resource. It helps people to understand how to control mosquitoes around their own environment, how to use repellent, and what the symptoms of Zika are. It includes our recommendations, again, for testing. So for the lower Rio Grande Valley right now, it's routine testing for all pregnant women. But we're also saying anyone who has a symptom of rash plus any one other symptom of Zika, we would like them to get tested as well, whether they're a pregnant woman or not. And we think that that's a great way, again, to detect the presence of Zika in a community and look for local spread. When we had the case in Hidalgo County, their health department did a fantastic job going out to the neighborhoods and knocking on doors, handing out information, and asking questions to people about symptoms of Zika.
And lastly, I just wanted to ask you, because we do have some rain on the way for the valley, what can people do right now to keep the mosquitoes at bay? What are some good practices?
Well, some great practices are just to go out around your property, and whether that property is where you work or where you live, and look for water that the mosquitoes can breed in. They can breed in tiny amounts of water, so things like a teaspoon of water is enough for them to breed in. But so look particularly in gutters, look at bird baths, at fish bowls, at plants where there might be an accumulation of water in the bottom of the plant, and drain those as much as possible. If it's not possible to drain a particular site, there are things called larvicides, in other words, things that kill the mosquito larvae, that you can place in those waters, and that will basically not allow the mosquito to breed. The mosquito, this particular mosquito, lives in very close proximity to human beings, so if you can clear out the breeding sites within about 200 yards of where you're located, you have greatly decreased the chance that you might be bitten by this particular species of mosquito, and therefore reduced your chance of getting Zika.
Well, Doctor, we appreciate your time this morning on this very important topic.